Good evening, everyone, and auspicious greetings to all of you. It is our honor to have our three panelists joining us tonight forum to share their wisdom with us. We are also like to thank all of you online that join in this forum. I am Venerable Jie Qian, the director of Fo Guang Buddhist Temple, Boston in Cambridge. Tonight, we come together to discuss about how we face the COVID-19 with a positive mind. For months, many countries and people all around the world are living under the shadow of coronavirus. The COVID-19 pandemic caused many people worry, nervous, and even in fear. Hence, we invite three panelists to share information on health advice, government reliefs and support program, personal well-being and emotional regulations. The audience are welcome to ask questions anytime by typing in the Zoom Q&A or YouTube chat, and I will answer, and I will ask the panelists questions on behalf of you. I'm going to ask our volunteer Ziyang to give a short introductions to you how to type in your question in the Zoom Q&A. Ziyang.
Hello, good evening and good morning, depending where you are. So first I will start with Zoom. So if you have Zoom, so you will see a screen like this. And at the bottom of the screen, you have a Q&A button. So when you click on that button, a dialog, a box like this will pop up, so you can type a question there. If you're on your mobile device, you can swipe to the left or right to have this Q&A screen. So mobile device experience will be slightly different. For YouTube listener or audience, sorry about that. For YouTube, you will see the chat. If you minimize your, not full screen on your chat, you will see the chat box that allow you to type in question. So you can type the question there. We will have volunteer copy the question over to Zoom for Venerable Jie Qian to ask to the panelists. That's all. Thank you, Venerable.
Okay, thank you, Ziyang. Now we will start the forum. We have three panelists tonight. They are Mayor Sapu Sudiki, Dr. Chen Han Wilfred Wu, and Venerable Dr. Jue Wei. I will introduce each panelist individually before they start to share their wisdom. Each panelist will have 10 minutes, and I will raise the 1 minute reminder to the panelists, which means that you have 1 minute to finish your speech. We hope to reserve more time for the audience to ask questions. Now we will start with the first panelist, which is our Mayor Sapu Sudiki. I hope I pronounced your name correctly. Our Mayor Sapu Sudiki is currently serving her second term on the Cambridge City Council and first as Mayor of Cambridge. Mayor immigrated to United States from Karachi, Pakistan at the age of 2, along with her parents and twin brother. She was raised in Cambridge affordable housing at the Raintree Tower and Roosevelt Tower. He attended Cambridge Public School, graduating from Cambridge Raintree and Latin. Mayor Sadiqi's passions for local activism and service motivated her to co-found the Cambridge Youth councillor. Now it is 17 years, and she earned a Cambridge Peace and Justice Award in 2006 for her activism. Thank you, Mayor, and we are very happy to have you with us tonight. In these few months, all of us are experiencing a challenging time through this COVID-19 pandemic. We hear that you have established the Mayor Disaster Relief Fund. We also saw the news about Cambridge citizen Emily He donated 5,000 masks and other PPE to your office. We hope to hear from you regarding the government relief and support programs that are able to help us get through this challenge together. Let's welcome our Mayor.
Sure, it's great to be here, everyone. Thank you to the Venerable for inviting me. I think I'll speak in less than 10 minutes, but I'll try to get as much information out to you. So this all started, the issue with this virus has been, happening for some months. And the way I learned about it was through my friend, Emily. And Emily had gone to China and Emily is a Cambridge resident. She'd gone to China to visit her mom and ended up, in China at that time, everything was happening, the outbreak was happening. And so she ended up in quarantine for a while. And I remember seeing her social media, and she was talking about being in quarantine because of this. And I said, oh, wow, that's crazy that's happening. And wow, the measures that the country is taking. And then a few weeks go by, February passes, and it's early March. And slowly I'm hearing things in the media, I'm hearing things coming up, but nothing's actually happening. And then there's a meeting that happens on March 12th, and it's a Thursday, and I won't forget it because I think since that day, we as a city have made many, many decisions, and that's impacted where we are today. So on March 12th, we knew that by then there had been about 4 cases. We didn't know this then, but when you look at the chart, you'll see that there were 2 cases on March 10th of the virus, and then March 11th, there were 2 cases. And now we're April 4th, and in total, we have about 149 cases. So in Cambridge. And so you've seen how that it's steadily increased. Some days there's more cases than others. There's definitely more cases than 149 because testing is behind. So March 12th, we had a regional meeting with myself and many mayors that the mayor of Somerville, which is a town next to Cambridge, organized. And at that meeting, we heard from experts from Italy, from China, who said, you have to take drastic measures in order to stop the spread of this disease. So what do these measures look like? And they said, you're going to have to close your schools. And then after that, it was a series of decisions. So we that day decided we were going to close schools at the end of the school day on March 13th and close them through April 6th. That was back then. And over that weekend, myself and the city manager, it's a team collective decision-making in Cambridge. We then issued many more statements and emergency measures to take forward. So we closed libraries, we closed a lot of our preschool and after-school programs, we closed our youth and senior centers, we closed a number of public facilities, we canceled all permitted events, we decided to close City Hall. And we also, took many other measures, all in keeping to really address this public health piece of stopping the spread of the virus. And I think that's what it's all been about. And as much as this has been the hardest thing to do, we do it because we have to, and it's for the public. And so I think what's been really good is that the public in Cambridge and in many of the cities and towns in Massachusetts, they've all said, okay, this is the measures that we have to take. I think it's very hard, of course, because there's so many impacts. There's impacts on the small businesses. There's big impacts on the nonprofits. There's impacts that are felt across the board. You know, even with closing schools, when you close schools, we had a lot of vulnerable population who were getting lunch and breakfast free. Now they don't have access to that. So we had to quickly figure out how we were going to get food to our most vulnerable families. We had to figure out how, you know, this was going to impact them. And so that's why we created the Mayor's Disaster Relief Fund, which now has raised over $3 million. And all the money that's being raised is going to go to families who are struggling to pay rent, who've lost their jobs. We've had so many people file for unemployment because, you know, businesses are closing, people are getting laid off, and that's where the role of local government comes in. We have to step in and help people as much as we can through this difficult situation. We are fortunate in Cambridge, we have the resources to do it. And so I'm mindful that a lot of places are not able to do what we can do. And so I keep that on the back of my head. We're very lucky to be in a city that has the resources that it does. But again, it's a team effort. So, you know, the Mayor's Disaster Relief is one way we'll be able to do that. On the federal level, there's a lot of different things that the government's coming up with, whether it's payments to households. You know, there's a whole list of different relief programs that relate to businesses as well. But on the local level, really is where some of this change can have an impact on individuals. And so, you know, one thing that we also did was we realized, you know, these restaurants are hurting because so many have to close. So how can we keep some of these restaurants in business? So we decided to launch a new project with the business community to support our homeless. So we said that we would provide, we'll contract with the restaurants, pay the restaurants to prepare meals and deliver these meals to our shelters and provide lunch and dinner for our homeless community. So, you know, we have to think think outside the box and do things where we are helping people and also helping the people who are being impacted in different ways. And so that's something that, you know, is very unique that we in Cambridge were able to set up. We've set up a food Cambridge Community Food Line, which is basically a food delivery service for residents who are unable to go to the supermarket. So this service delivers a weekly bag of groceries to eligible families and individuals. And so that's another thing that we're able to do. So it's these small things that are actually big things to help our most vulnerable population. We've, you know, had, you know, going back to my friend Emily from China, she shipped over 5,000 masks. So that I then worked with the Cambridge Police Department to then deliver to our local hospitals. And so our local hospitals are in, you know, high need of this PPE equipment, personal protective equipment. And so we were able to, you know, deliver these to the hospitals. And so we've had other companies donate a lot of the masks and hand sanitizer as well. But we need all, you know, it's all hands on deck situations, and you have to get very creative. So all that to say, you know, there's a lot that you can do on the local level. There's more that we're doing, but it's one day at a time, and we have to think ahead. Because this situation in the next month is going to probably get worse. We've had one death so far, and we have 149 cases, but really, as I said earlier, it's much more than that. So you have to operate in a reality that it's going to get much worse before it gets better, and really work with the community and work with everyone to do everything you can to make sure that people are staying home. and also have the resources they need to get by. So that's from the government, local government perspective of Cambridge, Massachusetts, which is 110,000 people you know, it's been a day-to-day process, but you know, I'm lucky that I can be able to help people, and we have a great city team working around the clock to help as many people as possible. So thank you.
Thank you, Mayor. Actually, I have to say that in Massachusetts, act very fast, especially in making a very difficult decision by closing down the schools and to close down some business, because the impact is very big. When the schools close down, the children have to stay at home, and the parents have no choice but to also stay at home. So this is a very tough decision, but I think that in Massachusetts, it's really, they really act very fast. And I can see that through a lot of news that the city sent it to me. The city has did a lot of things in trying to help the people in Cambridge. And I guess some of the people or residents in Cambridge might like to ask this question is that, what can they help? And this will be the questions that later on we might some of the people might would like to ask you, that what can we do to contribute at least a little bit to help out? So the next panelist will have our Dr. Chen Han Wilfred Wu. Dr. Wilfred Wu received his MD from National Taiwan University and completed his residency in surgery, urology at National Taiwan University Hospital, Taipei, Taiwan. He did his PhD in human genetics at the University of Utah and is now a clinical fellow in genetics and genomics at Harvard Medical School, affiliated hospitals. Clinically, he works in Boston Children's Hospital, Massachusetts General Hospital, Brigham and Women's Hospital, and Dana-Farber Cancer Institute. In research, he worked at Boston Children's Hospital and Broad Institute of MIT and Harvard. Dr. Wu also served as an associate editor for the journal Gene. And most important is that Dr. Wu is our volunteer in our temple, Fo-Guang Buddhist Temple, Boston, for years. And in last Friday, during our Chinese forum, Dr. Wu provided many important information and also health advice to us. Our temple got a lot of good feedback from the online audience to comments or to thank Dr. Wu for his information and advice. So now let's have Dr. Wu continue to share with us his advice.
Okay, thank you. Thank you very much, Chen, for the introduction and the invitation. I'm going to share my screen and to show you the slides I prepared for this talk. Let me share my screen first. Okay, so this is my talk entitled as COVID-19, 10 Minutes of Facts and Hope. So before we start, I have to read this disclaimer. So this presentation is composed of reviews of medical articles and information in public domains. The intention is to promote public awareness to combat the pandemic. This presentation does not involve any consultation, diagnosis, or treatment of any patient. And I do not represent the following 6 institutions that I work or I'm affiliated with. Okay, so let's get started. So let's start with nomenclature. We always say coronavirus, coronavirus. This is actually not a very precise term in terms of in medicine or science. So disease-wise, this should be called COVID-19. In terms of virus, it should be called SARS-CoV-2. And this is compared to the prior in 2003, there was a SARS outbreak coming from China and also expanding to Taiwan as well. And it was caused by the virus called SARS-CoV, and now it is called SARS-CoV-2. And in terms of disease, we call it COVID-19. Coronavirus is a more broader term. It actually, in this subfamily, there are actually 7 different viruses. So this HKU1 and AL63, these four actually do not cause severe diseases. But SARS-CoV in 2003 and the Middle East MERS-CoV in 2012, and now SARS-CoV-2, this caused very severe pneumonia. In terms of symptoms, there are actually many different studies. So I'm using this study from Wang that published in JAMA. This is a report from Wuhan, China. You can see that 99% of the patients in their series have fever. And there are fatigue, dry cough, anorexia, myalgia, and dyspnea. And also some have sputum production. But you can see that the percentage varies. So each patient may have different symptoms presented. And this is the report from this specific study. However, in other countries, so say in Taiwan they use different criteria for testing. They have this fever and also other upper urinary tract infection as a symptoms to do the test. But starting from today, I got an email from Taiwan CDC, and it says that starting from today, anosmia, meaning that loss of smell, and diarrhea will be included as a criteria for screening for testing for COVID-19. So talking about that, everyone may have different presentation. So there is a spectrum of severity. From this paper, Wu and others, this is also from Wuhan, China's report, we know that 81% of the patient has mild disease. Mild means no or mild pneumonia. It's no pneumonia or mild pneumonia. The patient may still have other symptoms. It's just like there's very mild pneumonia. 14% is severe disease. Severe means the patient may have short of breath, may have hypoxia, or may have, like in this CAT scan, more than 50% of lung involvement within 24 to 48 hours. And 5% are critical cases. That means that respiratory failure have to be intubated and on ventilator, shock, or multi-organ dysfunction. So far, we know that overall the fatality rate, especially coming from China, is 2.3%. If you look at the numbers in Italy, that's totally different, as 10% or even higher. But currently, we still quote the 2.3%. We think that Italy may not have the capacity to test more people. And there are people who are asymptomatic from the beginning to the end. So maybe as high as 18%. So this number is really hard to get this asymptomatic percentage. But this number is from Mizumoto and others. They study the patient from Princess Diamond Cruise, which anchored in Yokohama Harbor. So they, by the model, they estimate there are as many as 18% of the patient who has no symptoms but carry the virus. So that actually caused a big headache in terms of disease control. So when talking about different presentation or different severity, some people may think that young people are less affected, but it is actually not true. According to the CDC COVID-19 response team, this is their mortality and morbidity weekly report, which is published on March 26. You can see that x-axis are different age groups. The y-axis are the numbers of the patient. There are three colors here. The light blue is hospitalization, and then you have the ICU admission, and the most dark one is death. Across all ages group, except the pediatric group, you can see the significant number in younger population that need hospitalization, meaning that they are falling into the severe disease group. ICU group, same thing. The only difference is death. For the death, the patient who are more than 85 years old has higher cases of death. This is generally thought that because they have more underlying disease, they have comorbidity. However, there are concerns raising up in other opinions, saying that it may be those people, they have signed the DNR, which means do not resuscitate advanced directives. So people just give up. We don't know if that's true or not, but this is one possibility that we may think about. Okay, this virus, like many other viruses, they have incubation period. On the x-axis is days since infection. Y-axis is a proportion of the symptomatic cases. You can see that if you draw a line at 0.5, that means a median one. That means about 50% of the patient, they will develop symptoms around day 5 after they get the virus. When it gets to the plateau, it's around 11.5 days. That's around 97.5 of the patient will develop the symptoms at around 11 or 12 days. However, this actually raised a big alarm that still there are 2.5% of the patient do not develop symptoms at this date. However, this is one of the reasons that our like lockdown or shelter in place in California, or like a stay-home advice initially started with a 14-day period, or the quarantine in many other countries, including Taiwan, are using. This is where it is from. Okay, so how does it transmit? So this virus is a human-to-human transmission, very classical. So the major way of transmission is by respiratory droplet. This is very similar to the spread of influenza, but the severity, death rate is 10 times of, or even more, of the influenza. This is a major way of the transmission. The other way is direct contact of the secretion from the patient. And they have secretions with virus, and then we touch it, and we touch our mucosal membrane, and then we may get the infection. So in this paper from New England Journal of Medicine, you see that this virus, and this is SARS-CoV-2 and SARS-CoV, both of them, they can live on the surface of copper until maybe 8 hours. On cardboard, maybe 24 hours. On stainless steels, 24 hours. Plastic, 24 to 48 hours, 1 to 2 days. So this actually make it very difficult to deal with because of this long life on these different surfaces. So how do we prevent it? So we know that the major way is droplet, and the minor way is direct contact. What we can do is exactly what CDC is advising us right now. Stay at home. Stay at home. This is so important. The second one is social distancing. You can see that social distancing, it is recommended to keep apart for 6 feet. It's around 183 centimeters, almost 2 meters. And keep washing your hands when you touch anything that you think that is not safe. Using soap or using alcohol-based sanitizer is required to wash for 20 seconds with soap. Some people, they time and say, okay, if you sing happy birthday to you, you have to sing 2 times to fulfill that 20 seconds requirement. And disinfect the surface with either alcohol-based or you can also, on the CDC website, there are directions. How do you dilute the bleach? Dilute the bleach to do the disinfection. Also, you can use soap as well. So those are our options. And if you're sick or if you cough, please cover your cough and try not to touch your own eyes or nose or mouth, any surface, any mucosal surface, do not touch it. And wearing a mask. So wearing a mask, no matter if you're sick, definitely yes. If you feel you're healthy, there's still possibility that you're asymptomatic virus carrier. So it is actually now recommended by CDC and by City of Boston actually today started the recommendation to wear a mask to cover the eyes, not the eyes, cover the nose and mouth to when you are in the public area. It's impossible to cover your eyes in the public area. Okay. All right, so when people talking about social distancing, there are many people saying, is that effective? From this paper, yes, it is effective. The x-axis, so this paper is from Wuhan, China. The x-axis are the day, the y-axis number of cases. There are 2 kinds of cases they represent here. So the orange one is the by date of diagnosis. The dark blue one is the by date of onset. And there are lag between by date of onset and the by date of diagnosis because of the diagnosis capacity. So this is the day, January 23rd, 2020, Wuhan city lockdown. The second day, there were 15 more cities in Hubei province, China, get locked down. And then in China, they start the Lunar New Year, which was a national holiday. And they extend the Lunar New Year, say do not go to work, no school, everyone stayed at home. If you just look at the diagnosis, after lockdown, the case of diagnosis keep going up with a 2 weeks lag. So it's actually very depressing that, okay, everyone is at home, but the cases are still reported. However, if you chase those cases and to chase when were the symptoms onset, they actually fall like a curve like this. So it actually shows that starting from lockdown, the case actually start to go down. So this is actually give us a very good confidence that, yes, we are practicing social distancing right now, and we are staying at home right now. But we still see very depressing that the numbers still going up. But from the experience in China, we probably know that it will probably have a 2 weeks lag in between. But we have to keep hope. So this is actually telling us that, yes, it's effective. We have to keep hope and keep doing this. Okay. In terms of treatment, there's no specific treatment for coronavirus, but we have many clinical trials right now. Everyone can go to clinicaltrials.gov. This is our federal website. There are currently 282 clinical trials, and 186 interventional clinical trials are very specific to COVID-19. Some of them have attained the capacity of enrollment, but there are still 178 are new or active interventional clinical trials. So I would like to talk two new medicine that is used for COVID-19. The first one is remdesivir. So this one, probably many of you have read it on the news. This one is actually developed for Ebola virus. And it's effective for coronavirus in the past. SARS-CoV and MERS-CoV in this graph, you can see that they are effective. And this has both in vitro and in vivo data. So currently, clinical trials and compassionate use are available. The second one is chloroquine or hydroxychloroquine. So this is actually a very old drug to treat malaria. But there are in vitro data showing that you can see here that it has effective inhibition of the coronavirus SARS-CoV-2, the specific COVID-19 virus in vitro. So FDA has issued an emergency use authorization, and it's also available through clinical trials. So Venerable Zhichen is telling me I have 1 minute left. So I'll speed up. There are other treatments as well. So like TMPRSS2 inhibitors that stop the virus to go into our mucosa. IOC pathway inhibitor to stop the cytochrome, especially IL-6 storm, and plasma therapy for passive immunity. So talking about immunity, there are vaccines that is in development right now. So in this 2020 paper from Walls and others on cells, it shows that the polyclonal antibody to SARS-CoV actually blocks both SARS-CoV and SARS-CoV-2 in vitro. So this actually gives a big hope that yes, this will be effective. We may use this antibody to prevent people to get the SARS-CoV-2. At the same time, NIH and Moderna Therapeutics, this is actually a biotech company based in Cambridge, our local company. They're using mRNA-1273 as a clinical trial. And this clinical trial is currently under phase 1 trial. So this actually provides another hope for our vaccine development. So in summary, I want to say that there is hope. There is a hope in vaccine, there's hope in treatment, and there's a hope in what everyone can help just by stopping it. Everyone can help do your part to slow the spread by staying at home and keep social distancing. These are the two most important parts that we can help each other. You may be asymptomatic, but you don't know if you have virus or not. I want to say that we'll go through it together. We see that it has been cooled down in China. It may be cooled down in Italy, in Switzerland as well. But we really need everyone's help. We have to get it together so that we can get it through as fast as possible. Okay, with that, I would like to thank Dr. Krishna Theodoris. We had a journal club for this topic, and I actually borrow her slides in this talk as well. UpToDate.com, this is a scribed service for medical professional, but it is open for everyone right now for coronavirus topics. CDC.gov, so combating the virus is fighting a war, but the enemy is virus. There are many considerations, not only medicine. There are resources allocation, and there are like psychological consideration. So we still follow CDC.gov's recommendation. And I would to thank authors, patients, and animals in each paper I cited in this slide. If you like to have more information, both Mass General and Brigham's, they have their treatment guideline posted online, publicly available to everyone. So if you're interested, you can go to this protocol to see, okay, how you can do and to read it through. But I can tell you that it's changed rapidly day to day. And I will share my slide at this to a link. I will give it to Venerable Jue Qian and we'll post it online. Okay. And thank you for your attention.
Thank you very much, Dr. Wu. Your explanation actually helped us to get a better understanding about COVID-19 and also how to protect others by protecting ourselves or how to protect ourselves by protecting others. I think it's more important to listen to the experts' advice by wearing the mask, even though you might not have the cold or flu, but you will never know that whether you have the COVID-19 or you don't have. And also most important is that if you really have not an emergency things that you need to go out, just stay at home. And I believe that Dr. Wu, you will have more questions during the Q&A sessions to you. So stand by for that. So the next panelist is Professor Venerable Jue Wei. Venerable Jue Wei, she is head of program for Humanistic Buddhism, director of the Humanistic Buddhism Center, and the lecturer of Applied Buddhist Study at the Nantian Institute in Australia. She teaches subjects related to Humanistic Buddhism and Chinese Buddhism, supported by her research and development that revolve around acculturalism and application of Buddhist teachings in the modern world. She also authored Parading the Buddha, Localizing Buddha's Birthday Celebration. Venerable Jue Wei holds a PhD in Religious Studies, Master of Art and Buddhist Studies, a Master of Business Administration, and a Master of Science in Computer Science and Engineering. Venerable Jue Wei began her career as an applied R&D engineer in artificial intelligence system in the 1980s and moved on to management position in Singapore statutory bodies. She made her millennia decisions to join the Fo Guangshan Order when she realized that she could be of the best service to humanity through promoting humanistic value in an increasing divided world. To increase the accessibility of Venerable Jue Wei research and development, she leads global teams of volunteers to develop a humanistic visualizer, Humanistic Buddhism Journal, Communities of Practice, Turning Point Stories, Buddha's Birthday Education Program, as well as mobile apps and podcasts. Venerable Jue Wei has profound knowledge in research and also introducing Buddhism to the Western world. Today, Venerable Jue will share with us how her view in personal well-being and emotional regulations when facing the COVID-19. Venerable Jue.
Thank you very much, Venerable Jue Qian, for your introduction. First of all, before I begin, I'd like to express my gratitude to Venerable Jue Qian and your awesome team of volunteers working tirelessly behind the scene to put together this great panel. It shows that distance and time are really no barriers to the human heart. We all can be connected through goodness. So earlier on, we've heard from our distinguished panelists have given us both information and hope in the areas related to our basic needs and also our physical health. I'm going to now take a little turn and look in terms of what we can do in terms of our mental health. And the topic of what I'm going to discuss today is from the novel coronavirus to the novel coronavirus. I'm joining a movement around the world now to promote the coronavirus, but in my case, I'm going to bring in a humanistic Buddhist twist. First of all, karuna spells K-A-R-U-N-A, is a Sanskrit word meaning compassion. There's so much fear going on around the world now around this novel coronavirus because we don't know enough about it. We're not sure what's happening. And the whole world seems to have just turned upside down on us all of a sudden. So what I think will overcome fear is going to be compassion. And I take as a model the Avalokiteshvara Bodhisattva or the Guan Yin Bodhisattva that's sitting behind me. Each time I look at the Guan Yin Bodhisattva, I remind myself that Guan Yin listens to the cries of the world and gives the most precious gift, and that is one of fearlessness. For another epithet that she's known by is the giver of fearlessness. And she does so also by contemplation with perfect ease. So how can she give fearlessness? I believe that in the Buddhist context, one of the most important practice we have is the Noble Eightfold Path. And the Noble Eightfold Path begins with right view. So having the right view will help us to overcome those fears that are in us. So to do that, I want to borrow from a very common sutra that many Buddhists cite, sometimes on a daily basis. It's called the Heart Sutra. And I just want to take the first statement. And it says, Avalokiteshvara Bodhisattva, while contemplating profoundly the Prajna Paramita, clearly saw that the 5 skandhas are empty, and thus he overcame all ills and suffering. Now, this really perked my interest. How can the Avalokiteshvara help us to overcome all ills and suffering? So I said before, the Avalokiteshvara Bodhisattva hears the cries of the world, but he does so without something called spiritual bypassing. This is a term coined by a Buddhist psychotherapist practitioner, John Wellwood, about 30 years ago. Spiritual bypassing means to try to rise above or dismiss our suffering without fully facing and making peace with it. I'm guilty of that a lot of times. But now, as a Buddhist practitioner, I'm starting to realize that I cannot do that. The way to really help me to diminish suffering is to really face it. That the difficulties I face are likely to be the same difficulties that many others will face. And my experience may be helpful to others. Let me just give an example. Yesterday, I had the unfortunate experience of alarming a snake in the serene back hills of Nantian Temple. I was just walking up towards the Gratitude Bell, and there was a snake along the way. and it got very alarmed and it quickly dashed into the grass. While I was very shocked, the first thought that came to me was, oh no, I alarmed you, the snake. And I just joined my palms and I kept saying, I'm sorry, I'm sorry, I'm sorry. But was I afraid? I was really afraid. I was really afraid that the snake would come and attack me. But what I felt at that time was, I'm sorry that I've alarmed the snake in more ways than one. So perhaps if we think of it that way, could we also express compassion towards the coronavirus? That we promote karuna towards the virus and let it calm down. And perhaps if it calms down, it will be able to coexist with us in a very stable and peaceful way. So continuing with the Heart Sutra, the Avalokiteshvara Bodhisattva, while contemplating profoundly the Prajna Paramita. The Prajna Paramita is the wisdom and it is the perfection of wisdom, roughly translated. This Prajna Paramita is a very special form of wisdom which allows us to appreciate and understand fully the empty nature of things. In Mahayana Buddhism, the empty nature of things refers to both impermanence and interdependence. Let me first speak to impermanence. There's a very common saying that this too shall pass. We know that good times, the good times that we have enjoyed for decades now, this continuous prosperity around the world, that seems to have passed. The bad times, or the so-called bad times that we see today, will also pass, thankfully so. And you'll notice too that actually it's non-duality. What's good to some may be bad to others, and what's bad to some may also be good to others. Let's do our best to treasure the moment. There are many things in which we have no choice. We have heard earlier from Dr. Wu's wise advice that we should take this stay-at-home social distancing, this work from home. And as a result, we've also heard from the mayor that many people are suffering from reduction or loss of income. And for those in the essential services sector, they're working much longer hours. Now, we may have no choice about these, but there are other things that we have a choice on. And that is the way we see these things, our perception of these things. We have a choice. So for example, home quarantine can be rebadged as compassionate isolation. Consider it a gift to reduce the burden on the healthcare industry. Social distancing, maybe let's recall it, physically distanced but socially connected. Look at us now. We are physically thousands of miles or kilometers apart, but we are so much socially connected. Working from home, maybe let's rebadge it as love at home. We can now use those precious commute time to be with our partner, our children, and our parents. Reduction or loss of income. Maybe let's recoin it as immunity and community. We have more time now to do the things we've always wanted to do, to volunteer, to upskill, and to study. We may work longer hours. Maybe we call that caring and sharing. We have more time now to care and share for the people who really need our service. I only have 1 minute left, according to Venerable Jie-Tian, the host. So I will speak about non-self if you have any interest during the questions and answers. But I would just like to end by saying that maybe we can recall the words of Venerable Master Xing Yun, the proponent of humanistic Buddhism, in his prayer to Avalokiteshvara Bodhisattva for safety from the novel coronavirus COVID-19 outbreak. He says, quote, "Let us trust in the government to resolve the crisis. Let us thank the medical professionals for treating the disease. No matter how difficult the situation, as long as there is compassion and wisdom, when we all practice the 3 acts of goodness, do good deeds, speak good words, and think good thoughts, if we all protect the environment and have respect for all lives, we shall be able to turn peril into safety. Maybe we are facing a pandemic today, but all the solutions that we have today may help us as we face the inevitable fourth industrial revolution ahead of us, where there will be a lot more joblessness, and governments may have to look into how to provide universal basic income. Let this be an opportunity for us to revalue ourselves, recalibrate ourselves through reflection, and perhaps also to solve the climate crisis ahead. With that, I like to think that we will one day very soon turn back in a victorious state to say that we've learned to care and share with compassion and be the best that humanity can ever be. Thank you.
Thank you, Venerable Jie Wei. And as you mentioned, is that physically we are facing the challenge, but we should maintain a strong mind. Understanding the reality, understanding the impermanence, and everything will pass. So this is a very important advice that we have to really think that everything will pass. And now, all our panelists has shared their views with all of us, and it is time for us to start the Q&A session, which I have some questions that I can see on the screen. So I'm going to start with the questions here, and let me take a look. We have a questions to the mayor. Actually, it's a few questions to the mayor. So the first question is that, how is the testing capacity in Cambridge? Is it still the case that only people with severe symptoms can get tested? Mayor, can you on the mic?
Yeah, I'm sorry. So right now we know that the testing capacity, we're doing it through Cambridge Health Alliance. And so you have to be a Cambridge Health Alliance patient to get testing, and you have to be showing some kind of symptoms.
Okay, there's another question here is that somebody asks is it free to receive COVID-19 test treatment for non-US citizens without health insurance?
So at CHA, if we have to register to get tested. So I will have to find out. I think, as long as you can get registered, then you would be able to get a test.
Yes, because I think the person that asked this question is that we have a lot of international students here.
Yes, yeah.
And also there are a lot of international, this work permit over here. So there might be concern is that they can't go back to their country at this point of time. So if they need a test, can they get a test if they are not a non-US citizen?
Mm-hmm. I will confirm, I will find out and get that information. I don't want to misspeak, but I'll get back to you.
Okay. There's another question to you as well. This person is living in Cambridge and she would like to volunteer. Is there any volunteering opportunity in the local Cambridge community?
Yes.
Yes, okay.
So there are. If I'm happy to, if this person wants to email me directly, I can give her a list of things.
Yeah, because the next question that this person asked is that, is there a website where they can find information about the resources Cambridge provide about the volunteer opportunity? Any of the questions that, any of the things that they can help in always?
Yes, so if you visit our website, cambridgema.gov/COVID-19, there's some information on there. And then, we're updating our website, daily on different types of resources and different ways to get involved. So if she can't find it on there, I'm happy to, email her or him the information. But there's a lot of ways that people are volunteering. They're making masks. cloth masks that for the Cambridge Health Alliance. The Cambridge Health Alliance on their website has stated how to do that. And so they're looking for people to make masks.
I see. Okay. Okay, we have questions to Dr. Wu. So the question is that, okay, let me see. The WHO and CDC has recently recommended the use of non-medical home-make face cover for the public. As the mayor just mentioned, is that some people asked volunteers to make handmade masks. And Dr. Wu, do you have any suggestions on the material or type of fabrics for the best protection and reusability? Dr. Wu.
Okay. Yes, so the suggestion actually comes up with the shortage of the medical use mask. However, the suggestion is still a correct way to do. I didn't show another paper. It shows that the severity of the COVID-19 actually proportional to how much virus, what's the virus load a patient gets. So as much as protection would be much more helpful. Even you could protect yourself, like getting less, like 10% less, 20% less, 30% less of the virus, that would help. So no matter how much it reduce, it will help. So I'm not an expert of the material, but whatever you have, even a scarf, use a scarf to cover your nose and your mouth, that will be helpful. And when you go out, use a scarf. When you come back, you take off the scarf and then leave the scarf for like 3 hours or 1 day or 2 days. Then if there's a virus on the scarf, it will die. It won't survive. So this is actually a way to handle.
Okay. Another question to you is that there's a debate between acetaminophen versus ibuprofen for fever. What is your thoughts about it? Can they actually help to, as something that is not helpful to cure COVID-19?
Okay, so there are discussion about this using NSAID. So NSAID is non-steroid anti-inflammatory drugs, that including ibuprofen, naproxen, or others. There's no evidence that it would help or it would cause harm for COVID-19. So currently, we still use it as when the patient has fever. So there's no specific guideline right now, and this is truly under investigation. But currently, there's no specific say do not use. There's no such recommendation at this point.
I see. Okay. So we have a questions to Venerable Jue Wei, that somebody asked that many people are not used to stay home with their spouse, the loved one. Since they have been so busy with their life, what is your suggestion so they do not get on each other's nerves and prevent domestic violence? I have heard that domestic violence has increased since the stay-at-home order.
Thank you. Yes, thank you very much for the question. Remember, I mentioned earlier to consider this self-isolation, home quarantine as compassionate isolation, because it's a gift. It's a gift for us to stay home so as not to infect others. We don't know if we are asymptomatic or not, as Dr. Wu says, and we don't want to add burden to the healthcare workers who are already working overtime. So it's a very compassionate thing that we are doing. So that's a switch of mindset. The second is also an opportunity to exercise that compassion within the family. I can see that we are not used to working at home. That was me as well when I had to work from home and this building is empty. It took me a whole week of struggle in order to get accustomed to this lifestyle. But I keep reminding myself, of the Guan Yin Bodhisattva that's behind me. Each time I look at her, I remind myself I'm doing this for others, and I want to be compassionate to whoever I come in contact with. So I have a little tip. Maybe it's time to do something creative and interesting and enjoyable. For me, it's pouring art. So what I've done is trying out something like the pouring art, doing something interesting and useful. Maybe these are little gifts to ourselves and to others. Gardening, perhaps. It's time to remove the weeds from the garden. And as we remove the weeds, we are also removing that anger that's in us. So I'm hoping that, yes, let's acknowledge, as I've said, no spiritual bypassing. Let's acknowledge that anger that's in us. Respect it, understand, appreciate the conditions from which it comes, but also recognize the interdependence, that fighting it, struggling with it, and hitting out on others is not going to solve the problem. So let's look at more creative ways. Thank you.
Thank you, Venerable Jue Wei. And now we have some questions to the mayor again. So somebody asks is there enough PPE for medical staff in hospital in our Cambridge city here? Do we have enough ventilators prepared?
So, you know, our chief medical officer, he's not here, but you know, he would know the exact amounts, but we have enough, for now, we have enough ventilators and we have enough supply, but that supply, you know, even 2 weeks ago, there wasn't a shipment. And so we had 2 days worth of supply. Now that we are getting shipments, the shipments have been slow, but I think, you know, last I heard we had about 2 weeks worth. I mean, which is scary because, you know, you want to have much more than that, but our state delegation is working on getting more of the PPE gear. So right now we have it. It's still, the hospital is still looking for donations. And that's why, you know, GCP, which is a company in Cambridge, and others like MIT, Harvard, many other places have been working to donate the supply they have to make sure that we have enough and we're not running out tomorrow. So I can't speak to the specific amount of ventilators at Mount Auburn or at the Cambridge Hospital. But right now we are, you know, we're being cautious, but there's still, you know, we're looking for other opportunities still for more PPE.
Thank you. Actually, our temple, the lay members, our devotees, these few weeks we are having meetings to see that what we can help. We don't have enough members here, but we want to help a little bit. So yesterday night we have a meeting and we managed to buy about 2,000 NV19.
Oh, great.
Yeah, and we like to donate to the city, to you, and then you distribute to those places, hospital or senior home, anyone, and just donate to them. And also we would like to ask is that because we also want to do some fundraising in order to support. So is there other area or other things that you need anything for hospital or for the senior home or even for the grocery shops? Because recently we realized that the Trader Joe, the Whole Food, they have the staff continue working and a lot of people entering in. Actually, they are also in a very high risk.
Yeah. No, I mean, my mom is a cashier. So you know, she was home for 2 weeks and then today she went and we were all really mad at her. And so today she went and she realized there's so many people coming in. And so she said, you're right, I'm not going back there. But, you know, I worry about the workers like her. She's not going to go anymore, but many of the others who need to go because they don't have any other support. And so I worry about that. And so I think for them, we want to make sure that their companies are giving them masks So slowly we're making phone calls to these different grocery stores in Cambridge and making sure that they have the, something for their employees. But I think as far as fundraising, I mean, the fund that the city has put up, that is going directly to families and people in need. But, I know that there's a shortage of everything from diapers to food. So, really any money that you do fundraise, we can find a good spot for it. So, but I think the needs all vary right now.
Yes, we hope to get the mask in about 7 to 14 days because they're
Great.
shipping over from China over here.
Yeah.
And also we are doing the Facebook fundraising in order to get more donations from the members, for their families, from their friends, in order to support these residents in Cambridge.
Great.
So
great.
I will keep in touch with you.
Yes, thank you.
To see whether we can work out something.
Great.
Yeah. So there's another question which is quite important here to you as well. This person asks, Ziwei asks, is that any action has been taken to take care of the homeless people? Just found some of them are still living near the Central Square T station.
Mm-hmm.
So any things that or any arrangements to help them out?
So that's a great question. So the last 2 weeks, we have been working on a plan to basically build a shelter. And so it's almost complete, but we're using the it's called the War Memorial Recreational Center. And it's already the city's designated, it's already the city's designated emergency shelter. And so we're building out a space that will be supervised by one of our nonprofits that works with the homeless population. And so we hope that this week we'll start, welcoming, homeless individuals into 3 different parts that the city has broken up into. There will be a quarantine unit on the lower level, which will accommodate about 22 people. There's going to be an isolation unit in the gymnasium, which will hold about up to 50 people. And then 50 to 100 people would be fitting into the field house. And, we'd have the different social distancing in there, but it would be an emergency shelter that would include day programming and an overnight space for homeless individuals. So that has, most cities can't do that, but we've been able to build out the space. And so this week it's going to be operational.
Great. Okay, the next question will be to Venerable Jue. So this question is about, let me take a look. Okay, I have this question here. Give me a second. I just saw this question here about the karma. Okay, here's the question is that thanks to all the panelists' wonderful presentation. I like the term coronavirus that Venerable Jue presented. Recently, people in my congregation say that they are afraid of going outside, not only because of the COVID-19 concern, but also because of the Chinese virus. Can you elaborate more on how we can apply Buddha's teachings, especially we are one in this universe at these crucial conditions?
Thank you for the question. I know this is really a major concern, and it has started actually way back when the virus started transmitting out of Wuhan. I think that we need to be a bit more patient. If you don't feel safe, please don't go out. Situation will change. That's the Buddha's teachings on impermanence. But for now, let's appreciate the anger from others. It is true that this virus started in Wuhan. And so there is a natural hatred that people would exhibit onto the source of the virus. But perhaps we can do something to alleviate that anger and hatred. what we are doing now. China is sending in thousands of masks to the United States and many countries around the world to show friendship. I think we need to show more goodwill to many others. I think what Venerable Jue Qian is doing now is wonderful together with your congregation. And we build positive affinities that way. So wherever we are, as Chinese, this is an opportunity for us to show greater friendships towards anyone else who is suffering, to our neighbors, to share some joy with them in these difficult times. Let's exercise compassion. Like you've said, we are one, we are interconnected. We should not beget hatred with hatred. That's the last thing we want to see. So the best way, compassion, the coronavirus. Let's work together to bring the coronavirus out of our home and into the world out there. All the best.
Thank you, Venerable Jue Wei. And the next questions will be to Dr. Wu. So this question is that, what is the origin of this deadly disease? Like SARS, like MERS, like COVID-19, Ebola, Spanish flu. Are they related to, let me see, consumptions of wild animal like bats or monkeys? Would the chances of having another pandemic in the future be lower if we become vegetarian or vegan? What is your point of view, Dr. Wu?
Unmute. Yes. Okay. So talking about the origin of the virus, so people have to look at the genetics part, the genome of this virus compared to SARS-CoV. So I'm comparing SARS-CoV and SARS-CoV-2. They are the closest virus. And people also have, I didn't show that paper today, that's too long, but they have compared the virus that have sampled from bat, which is even closer to the SARS-CoV-2 that we are facing right now. So currently the inference is the virus come from bat, and then for some reason it goes to human and then start the pandemic. So this is what we understand right now. Regarding the consumption of monkey or some other animals, there are a lot of information on the website, but they have not been seen in the scientific article. I don't think I can comment on that, but I think as general, I don't feel comfortable consuming those animals. But in terms of virus transmission, this is something that we don't have evidence for to talk about that.
I see. Okay, thank you very much. And the next question will be to the mayor again. So this question is that, this person says that I'm a retiree, jobless. Do I get the COVID-19 relief paycheck of 1,200? Mayor, please on your microphone.
So this is the COVID-19. So can you repeat who the
question is?
Yeah.
Okay, this person is saying that he's a retiree and he's now jobless. So do he get the COVID-19 relief paycheck of 1,200?
So, you know, I think I would have to double check. I don't know the federal guidelines. I know that they're changing every day. There are specific income requirements that you have to qualify for. So that not everyone will be getting a check, unfortunately. So that's what, based on the most recent information I have, that you have to have, you still have to, there's certain guidelines. So based on that, it may not, that person may not be eligible.
Okay. If this person is the resident in Cambridge and he gets jobless and have difficulties to get food.
Yeah, we can help. We can help.
Where should these persons go to?
So that person can call the city, and we'll connect him or her to the resources. If they want food, we have a number they can call. And I'm happy to chat that, or I can, say it now if that person has a pen or paper.
Okay, maybe he or she can call the city phone number, right? In order to get more information.
Yes.
Yeah, because I believe that in this this period of time, a lot of people will really need help without job, without a pay.
They should call the city. And as far as food, we have the fund. We want to help as many people as we can.
Okay, thank you very much. And another questions to you. Massachusetts has banned the use of reusable bag in grocery stores due to COVID-19. What about the possibility of exploring the self-checkout options? Like what has long been implemented in Target?
So the self-checkout, I think you're supposed to not use your own bag, and the company, let's say Target, is supposed to be providing the bag free of charge. Is that the question?
Yes.
Yeah.
I think that's the question, is that can the other grocery shops or grocery stores learn from Target, is that they just self-checkout. Yeah, but I think self-checkout. So
self-checkout, you can, they'll at self-checkout, they have bags. And so you should be using, don't use your bags. There's going to be bags that they provide. And most of the grocery stores I've seen, they've been putting up barriers. They're putting up different social distancing measures, whether it's the space between you and another customer, wipes everywhere. So all the different things to make sure that things are clean and there's the proper hygiene happening.
Okay. Another question to you is that, do the landlord has the right to evict the tenants if they can't pay the rent?
So based on the new, moratorium you have, you will not be able to physically evict someone if they can't pay during this crisis. So if someone tries to, you can call the police, you can call the city. Right now, because of it's a public health emergency, no evictions should be happening. They can still try to file an eviction, but courts are not hearing these cases at all. If you want to work out a payment plan with your landlord, and if they threaten physical eviction, that's illegal right now. So you can't get evicted.
Okay. Another question to Venerable Jie Wei. My friends are worried about being fired. How to help them to release the stress and to stop being worried? Venerable Jie Wei.
I think that we will naturally be very worried when there is this potential loss of income. I think we'll have to sit through that and appreciate, first of all, that we have to help our employers as well to remain as a going concern. So if I happen to be the one who need to be sacrificed, I think we have to leave the company in goodwill and to let the employer know that during this absence, we'll try to upskill ourselves and still perhaps even if we have extra time to volunteer in some capacity for the company or for other organizations. Around the city now, as we can see from the mayor, she's looking for volunteers. And there are other groups who are looking for volunteers as well. Keep ourselves in meaningful life. I think the major problem we have now is not that virus out there, but really the fear and the virus of negative emotions that's building up in us. If it hasn't occurred, don't worry about it. We have not received the pink slip yet, so let's not worry about it. But when we receive it, we know we have to take it with a very positive light. So in the meantime, keep ourselves doing a lot of positive things, reduce costs at home for various things that we do, try to let everyone around us know that we have to conserve more now, and it's better for Mother Earth anyway, and then know our rights. You know, where are the governmental avenues we can turn to for assistance when we need it. So let's stay positive. We can do it together. All the best.
Okay, thank you very much. And I just received a very important questions to the mayor again. Many restaurants have temporarily closed. Once this pandemic is over, is there something the city is going to do to maintain the safety of the restaurant reopening? Is the city ready to be running at 100% for the safety of the residents? Most important, I hope most employees stay on payroll. So this is the questions to the mayor.
So I think right now we have staff at our community development department looking into, what does it mean 2 months from now, 3 months from now, for our businesses. And the reality is some businesses aren't going to make it. They're not going to make it because, there's so many challenges to even run and open up a restaurant, and a lot of savings and, and not enough resources. And so right now, the city is looking into ways that we can help financially, but even let's say if we're able to give a $25,000 grant to help with different things, that may not be enough. But we're right now in the process of thinking about how we will be able to go, back to having, once this period is over, we don't know when, let's say we can slowly start opening up as a city in July. There will be restaurants that will need more help. So does that, are we waiving certain fees? Are we, there's different things that we can maybe do and then can't do. And so right now we're in the process of figuring out how to help some of these small businesses.
Okay. This is the questions that I would like to ask is there a chances that the city will lock down if the COVID-19 is getting serious and very serious?
Yeah, I think, we look at the data and we look at, we rely on experts. And, I think the most important things, like the doctor says, you stay at home and social distance. And so if, we're seeing that our numbers just keep going up and up and up and that people are out, then we have to do something more drastic and something more like a shelter in place where we say, you can't leave. Right now you can leave for essential services. You can leave for, going to the pharmacy. You can leave to go get takeout, but at a certain level, we'll have to make the decision. And I think I'm ready to do that. And the city manager is ready to do that once, we look at the data right now, everything we've done, we've been faster than the state, we've been faster than most cities. But again, that may be already too late. So we have to see.
Thank you very much. So now we have about 5 minutes left. And I would like to ask the three panelists to say a few words or sentence to advise or blessing or anything to the audience. So can we start with the mayor to give a few words or sentence to the audience and to all of us to give some encouragement or advice to us?
Yeah, sure. I'll just say that, these are very challenging and unprecedented times that we're in. But to say that, you know, you also see how humanity is so connected, and you see how everyone is so connected. And that's what keeps me going. I've seen how many people have jumped in to help, how many people have offered resources, how many people who, you know, are willing to call, you know, a senior citizen, someone at home who doesn't have anyone, you know, people who are alone. And so it is this message of we are in this together, and we're all connected. And to keep that in mind, as much as this is so scary, and that every day is, you don't know what's going to happen, but to take that and just, it's just take it day to day. And so, you know, to everyone, you know, I hope you and yours are, you know, have that, you know, in their minds that this is, it's going to be okay. And it'll be okay because, you know, humanity, we are getting through this together. There's going to be there's already a lot of challenges, and there's so much pain. But, you know, we have to have each other. So thank you. And thank you so much for having me.
Thank you, Mayor. And Dr. Wu, do you want to say a few words to everyone?
Okay, yeah. So I think the most important thing I would like to say is there's hope. Don't give up the hope. There is hope. And everyone can help. By staying at home, by keep social distancing, you are helping others. That's the minimal things that you can do. Everyone can do that. And we are all connected together. This is something that only if we do it together, that we can win the combat for the virus. We will get through it together.
Thank you, Dr. Wu. And Venerable Jue Wei?
Yes, following my novel coronavirus theme, I've now created a novel coronavirus meditation based on the Heart Sutra. So if you are interested, please join me on Thursday, April the 9th at 12:30 p.m. Sydney time on the Nantian Institute of Higher Education's Facebook page. It's coming around the corner now. It's going to be Easter, and very soon many of us will be celebrating Buddha's birthday. So may I take this opportunity to wish everyone together, let's celebrate or commemorate the last rebirth. For the Christians, the last rebirth in heaven for Jesus the Christ, and for all of us Buddhists, for us to commemorate the last rebirth of the Buddha on earth. And we hope too that the coronavirus, the COVID-19 virus will also be having its last rebirth here. So happy rebirth day, everyone. May all be healthy and well in body and mind.
Thank you, Venerable Jue Wei. So tonight we have a very fruitful forum. We obtained a lot of important and useful information from all the panelists. How do we face the COVID-19 in a positive mind to gain the positive energy? And to the mayor is that I already get a confirm from our BRI members that they already ordered the 2,000 N95 masks, and now it depends on whether we can have a smooth shipping from China over here. So let's pray hard. And also to the members or any of the audience that you would like to donate to us to buy this 2,000 N95 masks, you can donate through the Facebook. We already type it in, or you can go to our Fo-Guang Buddhist Temple Facebook to do the donation, and we will donate this funding, the mask, to the city of Cambridge. So this is something that I would like to do some marketing over here. And also, if any of the audience that you would like to volunteer in Cambridge, in Boston, in anywhere, in Australia, please do so, because this is a time that we get together, we help each other together, and we get through all this challenge together. So thank you very much again to our panelists for giving us this 1.5 hours and provide this important information. And we hope that we can, together we can keep in touch, and let's join our hand to get through this challenge. And in this forum, for the past 2 forums, we hope to get some feedback from the panelists and also from the audience about this webinar. And if the feedback is good, maybe in future we can organize more online or webinar forums in order to share the information to more people. Maybe we can work with the mayor and see whether we can have some events or any of the forum or conference together and bring more positive information, positive energy to the local citizen. So thank you very much to the 3 panelists. Thank you very much.
Thank you.
Good night.